Well, let's think about two scenarios in the typical Silicon Valley concept. You can have a $250 deductible PPO, which is the classic Silicon Valley PPO, and the employer pays $500 a month for it. Or you can have a $1,500 deductible HSA plan, for which the employer pays, say, $400 a month for it. If you go off a 100-0 or 100-100 contribution model or 95 or whatever it may be, then in effect what you're doing is subsidizing the rich PPO more. So on the one hand, I'm giving you a choice, but on the other hand, I'm giving you a confusing choice because employers price plan A relative to plan B efficiently according to their benefits. So if you, the employer, then provide a differential subsidy, you're favoring one plan over the other. So the employee is confronted with, here are these two relatively complex instruments called insurance plans, where you, the employer, have given them a trick question in the form of a confusing choice. Where HSAs make a ton of sense is where you don't do that. It's where you give the same contribution. So in that same example, as an employee, I have a $250 deductible plan, costs $500 a month, employer pays everything. Great. Or I can have a $1,500 HSA plan. And in the $1,500 HSA plan, the employer pays the $400 premium, plus they give me $100 a month in an HSA contribution. At that point, my deductible is $300. So I'm taking on an additional $50 of risk. On the other hand, if I do what a lot of young, healthy folks do, which is I don't do any more than go to the doctor once a year, maybe get a prescription medication for the flu, the total cost of that would be about $150. I would pay that entire $150 out of my own pocket. However, the employer has given me $1,200 in the HSA contribution. I pay the $150 out of the $1,200 and I get to keep $1,050 myself. So in that scenario, what you've done by choosing the HSA plan as a young, healthy employee is you've actually got to keep $1,000 that you would not otherwise have. From the employer's perspective, they get two benefits. Number one, you have a happier employee because most of us are happier with an additional $1,000 versus without it. And then the second thing is employees tend to be more judicious in their use of healthcare when their incentives align and they're spending their own money. So more often than not, you, the employer, will end up with lower utilization as a result. That is precisely why in the majority of Lumide's groups, we almost always offer low deductible PPOs, but we almost always have 50+% HSA adoption. Because when you actually give the employee the right education and the right decisioning tooling, once they actually understand this, they will tend to gravitate voluntarily and happily to the HSA plan.